Hi, my name is Matt Friedman, and I am an emergency medicine resident at Mount Sinai Hospital in New York City on the Upper East Side. I'm one of the two editors of Evidence-Based Approach to Traumatic Emergencies. Here's a little plug for it right there. I was asked by emergency medicine practice to talk a little bit about it. What did I learn from it? Why do I think you all should read it? And so I'm going to go about doing so. I'm not going to stare at pale in it, by the way. I have my own little note cards right here. So if you catch me looking down there, I apologize. But first, why should you read it? And that's obvious. That's easy. Trauma is ubiquitous. Just the other day, I saw walking to work. I saw a 3-year-old girl get hit by a van. It was a very chaotic scene. There was no organization at all. It was very unstructured. Everyone was freaking out. And it's nice to be able to go in there and institute some calm, some structure, some organization, and to know what you're doing. If you're sharp with your skills, people see that, people recognize that, and people defer to you and let you do your exam. I mean, after all, we are the experts with trauma. We need to know what to do, when to do it, and most importantly, why we're doing it, and what's changed over the past 5 years to say that this is the reason why we're doing it, and we have the evidence to back it up. What I learned from this book is just how many hot controversial issues there are that are occurring every year. Every year there's like a 3 or 4 year long study with many patients enrolled arguing for one different procedure versus the next procedure, the way to be done. That's what's, especially for neck and abdominal trauma. There are just tons of hot controversial issues that have many organizing themes behind them, and many people have spent a lot of time, dedicated their, some of their life missions to conducting these studies to figure out what should be done and why. For orthopedic and wrist trauma, there's not as many hot controversial issues, but there's still many things to increase the throughput through the ER, which is very important for us. Also to increase the efficiency, which is very important to the patient. They don't want to be there 8 hours for their broken ankle. And there's nice ways to, ways for it to cut out time. So for instance, you can drop an x-ray here. What procedure works better? What does not need to be done until they have their orthopedic follow-up? What can you hold out on? So this book is applicable to you if you work in a 100-bed rural hospital in Nebraska, or if you're at a level 1 tertiary care center at any urban center in this entire country. Or if you're a moonlighting ER doc in an urgent care clinic, you will find things that are applicable to you. I promise you that. It's interesting, it's new. If you have any questions, please feel free to email me. You can get my email from EMPractice. And enjoy the book. Take care. Bye-bye.